So I graduated med school back in 2015. Went down on the Gold Coast at Bond University there. Shortly after finishing med school, I actually went up to Toowoomba as my first year as a doctor. So I spent a year out at the base hospital there. My wife and I absolutely loved it. It was, a real nice eye opener coming from the Gold Coast and having lived there all my life. Suddenly just experiencing something new. The pace of Toowoomba was just so nice compared to the Gold Coast, where it's always hustle and bustle. So it was just a really nice, refreshing year. So I spent a year out in Toowoomba for my internship, came back down to the Gold Coast to pursue specialist training because, whilst the base hospital is great, getting onto the specialist programs and sort of progressing your career can be difficult out there. So I came back down to the Gold Coast, spent 2 years in further junior doctor training before really deciding on which pathway I wanted to go. And I was really tossing up between doing something like ophthalmology or radiology. And I had a good friend who was in radiology who, just raved about it. He said, this is the best career. You give such, good direct care. Not, obviously always face-to-face with the patients, but you're really making a huge difference by, giving the doctors on the front lines, the answers to what their questions are so they can make, informed decisions and treat those patients. And, he was extremely happy in his line of work. And so I thought, yeah, look, let's give this a go. So I started with the Gold Coast Specialist Training Program for radiology, and that's a 5-year program. And I finished that up just at the end of last year, in end of 2023. Since then I've been working with South Coast here on the Gold Coast. But again, the hustle and bustle down here is just, not what I want with having a young family. I've got 3 kids, twins, 18-month-olds, boy and girl, and an older girl who's 5. And so just, with a young family and, at this stage of life, I thought, let's make a change again. We love Toowoomba, so I thought we'll come back to that. I think probably the biggest thing I found is, everyone thinks that radiology and pathology and those sort of specialties are very much, hidden away in a dark room or, looking at a screen all day. And it's really, it's quite the opposite these days, with the use of, procedures and, that sort of day-to-day face-to-face with patients. You're actually really communicating all day, whether that's with the specialist, with the findings that you find, or whether it's with the patient working out, what their symptoms are, what needs to be biopsied, that sort of thing. You can really add value and, not just simply the typical, thoughts of a radiologist being locked in a room looking at a screen all day. So yeah, I really like that, that communication aspect, that whilst it's, not, all day, every day discussing with the patient, you have that nice balance of, getting stuck in, working out some tricky cases and, putting your mind and your skills to use, working out, what's going on this patient's case, and then also coming to that more practical side of the specialty. So it's an all-round specialty. Look, I think it's probably in a few, and different cases in sort of different ways. I think probably some of the more rewarding ones is when you're doing a scan, say, patient might have maybe appendicitis or abdominal pain. You're trying to work out why, and you might find something incidental, say a small tumor in a liver or a breast cancer or something like that. And without having the thought, hey, maybe that looks a little bit weird, that cancer could have been missed. And so it's those changes to that patient's course which really I feel make such a big impact on their their care and their future moving forward. So that's probably one of the more rewarding sort of aspects when you find those subtle incidental things that caught early can really save their life. And then on the procedural side, it's so rewarding when you have a patient, literally hobbling into your room, back pain or that sort of thing. You do an injection and they're walking out pain-free. It's a really special thing, and just that relief on their face. And it's not just, a physical, pain relief. You're really giving them their quality of life back. So I think that's probably one of the most rewarding parts of the procedural side, at least. You don't always, and that's probably the small downside of radiology is you don't get to follow, their story, but you've made a significant impact at that time. Absolutely love gaming. Spent far too much of my youth, behind a computer or on the Xbox. Some know that, and with the 3 kids, that's had to take a back seat, and career and that sort of thing. But as my oldest, I should say, gets older, she started to play a little bit on the Nintendo and that sort of thing, and I'm just, yes, I've got that, got that connection with her that we can, bond over, and so that's been nice. Another fun fact: I used to play for Queensland in basketball as a high school student. Obviously, everyone else kept getting taller, and I stayed as a not short, but 180 centimeter, which is, I guess, short by basketball standards. So I had to decide whether I go academics or keep pursuing sport, and so decided I'll pursue the academics in grade 11. And but no, I really loved my basketball and hoping to get my kids into that up in Toowoomba. So I guess there's two parts to it. One is your day-to-day. So when I'm working up in Darling Downs, there is that, the wide scope of radiology in terms of the procedure work and that sort of thing. So you're not always in the room reporting, but essentially it's reporting what's come in either, through the hospital overnight down the Gold Coast if I'm helping them out, or any backlog from the day before. And then it's really just whatever comes through the door. So every day is really new and exciting. And we report literally the scope of medicine, from x-rays of fractures to staging scans from complex cancers to musculoskeletal injuries. Really, it's the breadth of medicine, and that's what's also great about radiology, is it's not isolated to one specialty. You have your subspecialists in, say, ENT or general medicine, endocrinology. They really are really good at what they do, but it's a sort of narrow field. Radiology, yes, we have our specializations within radiology. So I did a fellowship in musculoskeletal imaging before coming up to Darling Downs. But throughout my 5 years of training, I've reported and seen just the breadth of medicine. And so we'll do all X-rays, CTs, MRIs, mammograms, ultrasounds, you name it. We're exposed to it all day, and our day is really a combination of reporting what comes through the door, doing the procedure work, and either taking biopsies, giving pain relief, whether that's through steroid injections or spinal injections, that sort of thing. So it's a balance between the two, really. So the radiographers will take the images, or the sonographers will do the ultrasounds. Those images will then get sent to my computer, and depending on one is the acuity at which the doctor that's referred it has put on the case. So we'll get some cases marked as urgent. We'll try to prioritize those ones. Otherwise, we'll take the list as it comes, and whoever's come in first, we'll try to get that one done as quick as possible so they can get seen by their treating doctor and get things sorted for them. I think, throughout history, radiology has always been the most gung-ho in terms of trying new technology and integrating new technology into their everyday lives and their work. And that's no different with the advent of artificial intelligence. Even 3-4 years ago, artificial intelligence had already started to make its way into radiology, and even now we're using it quite extensively every day. In terms of your mammograms, we have AI programs that double check over our mammograms. Clots in the lungs, we have programs for that. Head scans. So it's already quite prevalent in radiology, and it's really a adjunct to what we do to make sure that those subtle findings that when you're having such a busy day, you obviously don't want to miss anything, and so that's our safety net already. As time goes by and AI keeps getting better, I think there will be a role for AI, with fractures and the simpler things where it can really take that burden off the radiologist, because current days everyone gets a scan. You think you can't go through the emergency department without getting a scan of some sort, whether it's an X-ray, ultrasound, CT. Medicine these days is not a purely clinical process anymore. Everyone gets a scan to make sure that the doctor who's examining you hasn't missed something, and so that burden on radiology is massive. The amount of scans is just too much for the number of specialists in radiology, and so AI is really going to help support the radiologist as time goes on. People get scared that, hey, is this going to take my job as a radiologist one day? And I don't think it will ever get to that point. The radiologist adds so much in terms of the the nuance of medicine and the putting the links together. AI at the moment is good at pointing out the facts, but putting them on a patient by patient basis and really understanding the meaning of those findings, it just isn't there yet, and I think it will take quite a while for it to really get to that point. You learn a lot. I think probably the most surprising thing, which I wasn't expecting when I went into radiology, is just the amount of knowledge that I had to acquire. And like I was saying earlier, with just radiology being such a breadth of knowledge in terms of you have to know every specialty's disease, you have to know every specialist disease on different modalities. You have to know what it looks like on an X-ray, what it looks like on an ultrasound, what it looks like on a CT and an MRI. So you have to know how disease presents itself on 5 different types of imaging, and and for every single specialty. So it was quite a shock, I guess, in terms of how much knowledge I had to acquire, and how much hard work I had to put into really remembering all the minutiae of medicine in every sort of scope. Sure. So I think, having finished my musculoskeletal imaging subspecialty, I think, having that subspecialty at the clinic is going to be really valuable for, your sports injuries, your fractures, all your MRI work is quite high level when it comes down to your fingers, your wrists, your ankles, that sort of thing. So having that subspecialty background will really, I think, help and contribute to, the population when they have their MRIs at Darling Downs. And another thing which I'm really, trying to push at Darling Downs is the pain management side of things, because I think it's really an area which makes just such a massive difference in patients' lives, where, like I said before, you have a patient that really, has just been crippled by their injury, or, a nerve impingement in their back or something like that, and they come in so sore, unable to move, and unable to do their day-to-day. And when I go in there, inject a spine, and that patient's walking out of there, it's such a rewarding thing. So that's something that I really want to grow in Toowoomba and through the Darling Downs practice is that pain management side. And we're actually bringing in a couple different machines to help with that, both with burning of nerves, so you get real long-term pain relief rather than just the steroid injections, and also a relatively new process called PRP, which is sort of an adjunct and a slightly more effective in certain circumstances to your standard steroid injections. So by hopefully bringing those two newer treatment processes in, we can really help the patients that are coming through Darling Downs more than just your standard steroid injections and your spinal injections, that sort of thing.